Welcome back to our live show. Sugary snacks and candies are plentiful, especially this time of year for Halloween. Well, today we're going to be talking about how you can prevent cavities and tell you all about the 4th annual Operation Candy Buyback Treats for Troops campaign. One of our favorite dentists and guests is back with us today. We welcome Dr. Marci Guthrie and her favorite dental hygienist and assistant and daughter, Miss Hannah. Great to see you, Miss Hannah. How are you?
Good.
Can I get a little knuckles right there? A little interested in what you look like on TV, huh? Mars, great to see you, Doc.
Thank you
for
having me.
All right, so Doctor, I'm sure for parents, moms, dads, grandparents, this time of year, really, the kids are susceptible to cavities, aren't they?
Very
I mean, really
so.
Throughout the year, but right now it's candies galore.
Yes.
What causes cavities?
So I wanted to talk about the multifactorial factors that cause cavities. So we have to have all 4 of these for cavities to happen. So we have to have the susceptible tooth, a baby tooth, an adult tooth, a crown tooth, a root canal tooth, any live tooth.
There's a lot of teeth.
Is susceptible. Sugar. Here we have some of our opened Halloween candy that I even brought from home because we've already broken into that ourselves. Time. So it has to sit for amount of time. Sippers, snackers. Time is a factor with decay.
Interesting.
And then bacteria or sugar bugs.
Uh-oh.
So,
sugar bugs are bad, aren't they? Right, Hannah?
Yes.
They're bad. And what's the 4th one?
Well, those are the 4. The teeth, the sugar, the bacteria, the time, all these together create cavities.
That's great. And how long, Marci, does
That's
it
a good question. So, you know, I think everybody is different. It depends on how well you clean your teeth, what your salivary flow is like. There's all types of factors, medications and things that make people more susceptible versus not in their home care. So,
and Morris, there's obviously brushing helps,
Correct.
but sometimes you miss a spot, right?
Absolutely. There's lots of nooks and crannies that can be missed.
Even expert brushers can miss, right?
Even expert brushers can miss. So for my kids and adults at home, I've talked about the Disclosing tablets a lot, and we like to use this for educating the children and adults for what can be missed.
What is a Disclosing tablet? What do they look like? Oh, look at this. The trusty assistant right here. It looks like a candy. Is it a candy?
Mm-mm.
No? Have you had these before?
Uh-huh.
All right, so what do they do, Miss Hannah?
They get your teeth pink and they show you where the cavities are.
They get your teeth pink? So it can be fun, too. So can we demonstrate right now, Doc?
Yeah.
All right, let's see.
How do you do it?
This takes place after brushing, Doctor?
Well, this can take place after brushing to test to see if you've done a good job and to show you places that you could have possibly missed. It can take place before you're brushing, and it is really helpful to show how this can be demonstrated and not make a mess at home for the sink.
How long does it take?
It doesn't take too long. You just chew it up like this, and then you're gonna have some water.
All right.
And you're gonna swish.
Swish, 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 swish. Are they readily available, Doctor?
You know, sadly, it was very challenging for me to find them at the pharmacy, but I do have a link on my website for Amazon where to find them.
Whoa, let's hold this shot right here. Look at that. You are ready for Halloween. Whoa. So in all seriousness, Hannah, keep your mouth open. Doctor, what are we looking at right here? What should we be looking at?
So nobody wants to walk around with their teeth like this.
No.
And it gives children a good visual of plaque. So a lot of it is around the gum line where it's darker, but more importantly, the top surfaces of our teeth. The grooves on the top surface of the teeth are the most common places for cavities, and then for my non-flossers, in between the teeth, which are a lot of areas that you can't see.
So if you see the darker color, is that where we have missed, or is that
You want your teeth white.
You want your teeth white.
All the pink needs to be gone.
So little Miss Hannah has been having some Reese's earlier today, and is that why we're seeing so much dark color?
Possibly. She did not brush her teeth after that. So yeah, I gave her.
Brush your teeth.
That was her breakfast this morning.
That's my kind of breakfast. Breakfast
Getting
of
her
champions.
ready for this.
Maybe not for dentists. Marci, tell us about this Troops campaign. We have a minute.
So we are giving $1 per pound of candy up to 10 pounds that we give and donate to the troops overseas to give them thanks. So we are collecting from November 1st through the 9th at our office. So bring it on in, we'll weigh it up, and it's a good way to give back to our heroes and get it out of the house.
Yeah, and Marci, I mean, this time of year, you know, the kids come back with buckets and buckets of candy. They don't need to eat all of that, right?
No, they do not. Or just have it and then get your Disclosing tablets and do extra special home care. The stickies and the chewies are the hardest to get out. Reese's peanut butter cups is what I let Hannah have this morning because they're soft. I've already seen the emergencies. What's broken people's teeth? Whoppers.
Oh no.
The good and plenties I've heard.
The sticky ones, the hard ones,
They'll
they're
pull out
really,
fillings
really bad.
and then they'll just sit in those grooves and they're hard to clean.
And then we see you when we're sitting in a chair, don't we? For a
Right.
long time.
Yeah.
Hannah, all right, quickly, what are we going to go as for Halloween?
Charizard.
What was that?
Charizard.
Charizard? Is they?
Charizard, her Pokemon figure.
Pokemon.
Yeah.
Man, they're still popular. Hannah, give me some knuckles right here. Great job. Brusha, brusha, brusha. Dr. Guthrie, it's always a pleasure. It's great to see you. Listen, James River Family Dentistry presents the 4th annual Operation Candy Buyback Treats for Our Troops campaign. It's such a worthy cause. Candy will be collected, as you heard Marci say, November 1st through November 19th at 2805 McRae Road, right there in South Richmond. For more information, we're going to post a link on our show website by early this afternoon at WTVR.com. Thank you so much, ladies. Great job, Hannah. Happy Halloween.